Okay, so we're going to pick up where we left off in class. If you remember in class, we were talking about and initiating the conversation on the hip joint and pelvic girdle. And remember, we were talking about how, really in close connection with the knee, and part of that is because of particularly the muscles that cross both the hip and the knee. So it's going to be important to know both hip and knee function and some of the different structures in and around the knee. And the test from this section is going to encompass the hip and pelvic girdle, the knee, and the lower leg, ankle, and foot. So all these areas are kind of connected. So we're going to be discussing the knee. We started talking about the knee and some of the structures. So here's where we're kind of picking up where we left off when we were last in class. So some of the other structures, when we look at this, we look at the patella. So you're seeing a sagittal cut here of the patella. If you're looking here, you can see the patella. The patella is called a sesamoid bone. So what a sesamoid bone is a bone that, as you see, we call it a floating bone. It kind of sits in the soft tissue. So here's the tendon coming off of the quadriceps. Okay, so you have your patellar tendon, and the patella kind of just sits within that structure. Okay, so it's embedded in there. In that tendon. Now, sometimes we do, as you see over here, we talk about the quadriceps and the patellar tendon. So sometimes textbooks and people break it up into two separate structures. The quadriceps tendon is this part right here. So it's the part that immediately comes off of the quadriceps, and then they call the bottom portion the patellar tendon. Okay, in this picture you can see they just call it the patellar tendon, but if you do see it broken up, and it's good to be able to notice that distinction between the two, and that what the patella does and what sesamoid bones typically do is they serve as a pulley. So what they do is they increase the leverage for the muscle to be able to produce its action. So in this case, the quadriceps performs extension at the knee joint, and by having that patella in there, it increases the leverage so that when you're, going to extend your knee, it allows for greater strength and movement. It also does have a slight protective function as well to the anterior surface of the knee. The anterior surface of the knee has some of the other soft tissue structures underneath there, and it does also serve kind of as a protector of that. But from a movement perspective, it's really important for the leverage and increasing the lever arm of the quadriceps. The fibula, which is not in the picture that we're looking at, so that's the lateral bone of the lower leg. As we talked about, the tibia is the primary weight-bearing bone of the lower leg. The fibula serves as an attachment for the other knee joint structures. It does not articulate with the femur, and it is actually not part of the knee joint. So the knee joint is actually, if we were looking at it structurally, giving it its structural name, it's the tibiofemoral joint. The fibula does not is not a part of the actual knee joint itself. It can be involved with some knee pathologies just because of the proximal portion being in such close proximity, but is not actually a part of the knee joint itself. Okay, here we look at some of the anterior structures of the knee. So if we look at the femur here, you can see the condyles. Here's the medial condyle and the lateral condyle. Again, the epicondyles are the areas immediately above that. So again, the condyle is the actual portion down here. The epicondyles are above that. You also have the adductor tubercle, which if you look here medially on the femur, that's your adductor tubercle where the adductors will attach. You have your patella, as we had talked about. And then if we look at the lower leg in the articulation, again, the tibia is part of the knee joint. It is the medial bone. It is the primary weight-bearing bone. You have the medial and lateral condyles of the tibia. So you can see here's your medial condyle, your lateral condyle. You have the tibial tuberosity, which is this structure right here that you could see with the laser pointer. You have your Gerdy's tubercle, which is right in over here. It's anterior lateral, and we'll talk about what structure comes in. There's an important structure that comes down and attaches there. And then you have your pes anserine, which is right here. And that's going to be an attachment site for muscles as well. Okay, so that's on the anterior and medial surface right in this region. And then you have the fibula with the fibular head pictured. The proximal end of that is going to be right here. So when you're looking at the fibula, it's going to be important to be able to differentiate between the proximal versus the distal end when you're trying to, be able to look at your anatomy. There's not a lot of anatomical landmarks on the fibula, but you're going to have to be able to differentiate particularly the proximal and the distal end. Here we go. Posteriorly, again, you can see the condyles. Here's your medial condyle, your lateral condyle. You can see the adductor tubercle up here. Again, you have your medial and lateral bones, the tibia and the fibula. And again, you can see the fibular head. So again, as I've always talked about and said, whenever you're looking, whether it's a model, an illustration, in these PowerPoints on your note slides, make sure that you orientate yourself with what it is that you're looking at, and then go from there. So if you're having trouble being able to see what's the anterior versus the posterior side, find a determinant or find a landmark that you can use. I gave some ideas in class. Utilize that to your advantage to being able to know what angle you're looking at the bones from, so you could then know where your landmarks are. Okay, so that's going to take us to looking at some of the different ligaments. Okay, so here's the pelvis. So you can see here the pelvic ligaments and some of the various ligaments within the pelvic girdle. So looking at this, you can see the iliofemoral ligament. So again, think there's sometimes something to a name. So here's the iliofemoral ligament. So what does the iliofemoral ligament attach? Attaches the ilium to the femur. Okay. You have the pubofemoral ligament. Okay, goes from the pubic bone to the femur. Okay. Those are the ligaments that are going to make up. You're also going to have the ischiofemoral ligament, which you cannot see in this view because it's the anterior view. You're going to see that in the posterior view. But again, a lot of times, again, there is something to a name. Take a look at some of these other ligaments in and around the hip joint so that you could kind of recognize where they're located. Here's the posterior view. So here's as I said, so from the hip joint perspective, you have your three ligaments. Here's the ischiofemoral ligament right here. So again, the ischiofemoral comes from the ischium and attaches to the femur. So again, the three ligaments for the actual hip joint itself are the iliofemoral, pubofemoral, and ischiofemoral ligaments. Okay. You could see some of the other important ligaments here as well. You have some of your bony structures as you're kind of looking across. But take a minute and look at these, just kind of see the general locations. I pointed out the hip joint ligaments for their sake, but again, bear in mind some of these other structures, particularly the different ligaments that articulate between the pelvic bones and the sacrum. Okay, looking at motions and muscles. Okay, so location is key in determining action. This is another thing we had talked about. So, think about where the muscle, even without seeing the specific origin insertion, be able to look at these muscles and see their general location. Their general location a lot of times is going to tell you at the very least what the action is. Okay? So it'll make it a lot easier in kind of making that determination. Okay, so looking at the movement of hip flexion. So we know that the hip is a ball and socket joint. It has 3 degrees freedom of motion. So hip flexion, which is going to be movement in the sagittal plane, movement of the femur anteriorly towards the pelvis. So you can see in this picture, you can see the femur moving anteriorly towards the pelvis, okay? So here's a hip in extension, here is the hip moved into flexion, okay? So think about it for a minute. Where do you think the muscles that perform this action are located? Think about it for a minute. Where would they be? Okay. Well, they're going to be located on the anterior part of the femur. Remember, we talked about muscles will typically create, when we're talking the primary movement and what the muscles are meant to do, we talk about it being a shortening contraction. There are different types of contractions that muscles do. The primary, when you're moving against gravity, the primary type of muscle contraction is going to be a concentric or shortening contraction. So in order to create this movement of hip flexion, it has to be in the anterior femur. Okay, now we are going to get into specifics as far as origin insertions. Here we're just kind of looking a little bigger picture. So your anterior femur muscles, the muscles that are in the anterior surface, the iliopsoas, the pectineus, rectus femoris, and sartorius are all muscles that can perform hip flexion. And you can see them on the illustration there as far as what they look like. And again, you'll see pictures later on in the discussion showing you what these muscles look like individually. Okay, here we look at hip extension. Okay, so again, sagittal plane movement. You're going to be looking at movement of the femur posteriorly away from the pelvis. Sometimes this is referred as hyperextension. So if you hear this referred to as hyperextension, so it's just they consider it as extra extension, because technically extension is movement from flexion. So if you remember the previous picture with the thigh up here, technically just bringing the hip down into this position is considered extension. Some do consider this extra movement hyperextension. Either way, it's still the same general movement. It's movement of the femur in a posterior direction. So again, pause, think for a minute. Where would the muscles that perform this action be located? Right, you should be thinking the posterior femur. Okay, so the glute max, the biceps femoris, semitendinosus, and semimembranosus. So, the three hamstring muscles, okay, which are two joint muscles, they work at both the hip and the knee. They extend the hip along with the glute max. So those are the primary muscles that will perform that action.